What's up YouTube, I'm Mike, and today I'm going to re-record a video that I shot in the past. Royal Men's Medical Center is the company that does my hormone replacement therapy, and they recently offered me a promo code to share with you guys that if you decide to sign up for hormone replacement therapy, you can get 6 months at a discounted rate. So be sure to use code MikeFit at sign up, and then they will give you that 6-month discounted rate. Also helps the channel out. So I'm going to do an unboxing to show you exactly what you can expect to get and exactly how to use it. So for those of you who are already familiar with this process, this may be a little bit dumbed down. This is really for guys who have never done hormone replacement therapy before and are maybe a little bit nervous about getting started. I know for one, I was very nervous. It felt like I was jumping on steroids and you're using needles and all of these things that can be kind of scary, but it's really very, very simple once you get to it, and it's very, very easy. So hopefully this will cut down on some of those fears. So once you get signed up and you get in the program, they ship the meds to your door, which is way better than having to go somewhere and get your injections done, whether it's at a doctor or a clinic that requires you to come in person. So the meds will come in a box just like this. Depending on where you are in the country, yours may come from a different pharmacy. Mine comes from Hollandale in Florida. So when you get your kit, every single thing inside of your kit has your own independent prescription label on it. Now in Texas, we don't need scripts for needles, but everything that comes from this pharmacy will have your script just in case you need to go out of town or you're flying out of the country or whatever. You'll be able to prove that everything in your box that comes from Royal Medical is in fact your prescription meds. So the first thing here was we have a box that contains the gonadorelin. This is what they had to replace HCG with when the federal government screwed that up for all of us. Inside this box, you will have a couple of items. One is a bottle of bacteriostatic water, and two is the vial that contains the powder which has the gonadorelin in it. You have to reconstitute this powder. Now stay with me, it sounds complicated, but it's very easy, and it's definitely the more complicated part of this entire process. They give you inside of your kit this large drawing syringe. You take this syringe and you put the recommended amount of water, I believe it's 5 milliliters if I remember. You draw the water out of this bottle. First, you snap off that plastic lid and it will expose the rubber underneath. Then you take your large drawing syringe, you draw up the recommended amount of water, and then you do the same thing over here. You snap the plastic top off. You slowly put the water into the vial. All of this will be explained in your kit. There are videos also online that you can see, but I'm trying to make it simple for you. You inject the water into this vial, and then it will be reconstituted. Then you can do your shots once or twice a week, whatever you're prescribed, and then keep this in the refrigerator. That is by far the most complicated part of this entire process, but don't let it scare you. It's very, very easy once you get used to doing it. Inside this box also are 2 alcohol wipes. They do not provide alcohol wipes for the rest of your injections. You definitely want to have alcohol swabs. I'm going to leave those out for a second to show you something later, but you can go on Amazon. You can get them. They're very cheap. Also in the box is going to be your testosterone. It comes in a box like this. Sometimes it'll come in 2 smaller boxes with two 5 milliliter vials. This time they sent 1 10 milliliter vial. Looks just like that, says testosterone cypionate on the bottle. This is your injectable. Royal Men's uses grapeseed oil as the carrier oil. That's also put on the bottle. Depending on how yours is set up, you may have your Arimidex infused into the injectable. That makes it very easy because you're just dealing with this injectable and that injectable. For reasons that are outside of the purview of this video, I like to be able to dose my Arimidex independently. So for me, they send the Arimidex in a bottle of actual pills. So if you choose to go that route, you'll have a bottle like this. I don't know why they use these gigantic bottles. There's like 8 pills in here. But nevertheless, you'll have a bottle that contains your Arimidex with a prescription label. And then you'll have your testosterone. The way you're going to want to inject your hormones is, again, you pop that top off. I'm going to leave mine on just to try to protect it until I need it. But you pop the top off, And then you have this package that has your syringes. The syringes come preloaded with an 18 gauge needle. I'm gonna take one of these out so you can see it because this thing is a harpoon. It's a very large needle. If you've ever donated blood, then you have seen this needle before. It's what they use to draw the blood out. So you have this 18 gauge pin. Be very careful putting that back in there. You take the 18 gauge pin and you draw up the volume of your shot. For most of you, it'll be 1 cc. So this is a 3 cc or 3 ml pin. Cc and an ml is the same thing. So you want to draw down to the 1 on this syringe. So you take this into the vial, you pull down to 1, and you do not want to inject yourself with this gigantic pin. So to make it easier for you, they include another package with a bunch of 25 gauge pins. I'll show you what one of those looks like. So this is the 25 gauge needle compared to the 18 gauge needle. So obviously a substantial difference. You definitely want to inject yourself with that 25 gauge or less. Now be careful if you take pins off like this, because I've almost done it to myself. Make sure you're putting the right needle back in the right cap, or you'll push that large one right through that smaller cap and into your thumb. So let me cover all this back up. Obviously you shouldn't be playing with the needles. I'm just doing this to show you what it looks like. So you will have your injectable drawn into this syringe. You unscrew the 18 gauge, just like that. It just twists on. You untwist it. You twist on the 25 gauge pin, and now you're ready to inject. So if you're going to use your glutes, which if you do, I recommend the top part of your glute. Some videos will tell you to hit your quads. I never do that. But regardless, before you do your injection, you have your preloaded syringe. You take your alcohol swab. You swab the spot that you're going to inject. And then obviously you remove the cap, insert the pin, inject your hormone, take it out, dispose of this in a sharps container, and your injection is done. Like I said, for most of you, you'll be recommended 1 injection per week. I choose to do it a little bit different, but again, that's for a different video. So if you want to learn more about hormone replacement therapy, there are a number of videos on my channel that show how to inject, what pins that I use, and some different protocols that you might end up trying. But typically what you're going to be prescribed is 1 ml a week with your gonadorelin taken twice a week. So that's what the kit looks like. It's a very, very simple process. They give you basically everything you need with the exception of the alcohol swabs. And then when this kit is consumed, you will get another one in the mail. So they automatically come. You don't have to worry about it. You don't have to do anything. Your hormones come straight to the door. You don't have to go to a pharmacy. You don't have to do anything, talk to anybody. And then on some interval, they'll have you do blood work to make sure that everything is dialed in. So this is what the kit looks like. Again, it's very, very simple. Go to royalmedicalcenters.com if you would like to sign up. And during sign up, be sure to use code MikeFit. They'll give you a 6-month discount, and it really helps out the channel. So hopefully this has been informative for all of you. If you have any questions, as always, you can follow me on Instagram. Leave them in the comment section below, and we'll see you on the next one.